Hello everyone. This presentation attempts to address the issues of obesity in Australia and how healthy public policy that integrates national active living strategies and healthy food promotion can have a dramatic impact on the population health status. So why is there a need to address obesity with government intervention? According to the National Health Survey conducted in 2014 to 15, 63.4% of Australian adults were overweight or obese. That's 11.2 million people. This has risen dramatically since 1995, when being overweight or obese accounted for just 22.9% in comparison. Alarmingly, this toll is also affecting kids, where 1 in 4 children aged 5 to 17 years old were overweight or obese. On top of the individual cost, the growth in obesity also puts added pressure on the health system, as it is a risk factor for a wide range of conditions including cardiovascular disease, diabetes, and several cancers. Obesity not only has a significant health and social impacts, but also considerable economic ones. According to the Australian Social Trends from 2009, the total annual cost of obesity for children and adults in Australia, including health system costs, productivity and carer costs, was estimated to be around $58 billion. In 1988, the World Health Organization in Adelaide saw the initiation of healthy public policy, which is characterized by an explicit concern for health and equity in all areas of policy and by governmental accountability for health impact. The main aim of healthy public policy is to create a supportive environment to enable people to lead healthy lives. Healthy public policy, like Towards Zero Growth, the Healthy Weight Action Plan, focuses on strategies that will make active and healthy lifestyle choices easier. Bringing this policy together has meant a whole-of-government effort which included representatives from all ACT government directorates, key non-government and academic organizations with expertise in obesity as a public health issue. Healthy public policies can affect any sector of the government, including agriculture, trade, education, industry, and communications, which may only have an indirect connection with disease and prevention or treatment and care. Governments need to continually invest resources in healthy public policy and health promotion by keeping up with the newfound research and striving towards continually innovate ways to raise the health status of all their citizens and stamp out health inequalities. This is in line with the basic social justice principles, which is to ensure that people have access to essentials for a healthy and satisfying life. The Healthy Weight Action Plan specifically contains actions to reduce the availability of energy-dense, nutrient-poor foods in institutions like schools, universities, and workplaces, increased opportunities to be physically active by improving infrastructure for active recreation or transport, enhance the way that physical education is delivered in schools, and reduce the promotion of unhealthy foods in shops and communities. These types of measures, though challenging, ensure equitable opportunities to healthy lifestyles, which at the same time raises the overall societal productivity in both social and economic terms. An Australian Vision for Active Transport of 2010 reported that just 30 minutes of exercise a day would equate to a healthcare system saving of $1.5 billion a year. Disturbingly, about half of Australian adults are not sufficiently physically active to gain health benefit and are at increased risk of developing non-communicable disease. So, to help us better understand the benefits of active living, It's Your Move case study will demonstrate the relationship between the built environment and physical activity. It's Your Move, or IYM, took off from a research project undertaken to reduce unhealthy weight in adolescents by 3 schools in 2012. Now the ACT government initiative encourages high school students to develop creative solutions to improving school health with a focus on nutrition and physical activity.
This project was the first system-wide, community-based obesity prevention project among Australian adolescents. To date, 12 schools around Canberra, including the 3 intervention schools Alfred Deakin High, Calwell High and Melrose High, have participated, and there are hopes that school participation will continue to grow. Measures that will be discussed have been collected from baseline May 2012 to May 2014. The project demonstrated early success in utilizing a systems approach and integrated multi-level intervention strategies at various levels in the school and community environments. These range from individual level factors such as food available for consumption at school and physical activity spaces available to students, to community-wide activities such as food at school policy and redeveloping school curriculum to incorporate more physical activity. All schools improved their food choices to include access to fruit, reduced fat yogurts, reduction in fruit drink availability, and the elimination of non-diet soft drinks. The ACT Population Health Bulletin Volume 7 and Issue 1 reported that the 2 of 3 schools showed a significant decrease in the prevalence of overweight and obesity. The 3rd school achieved no increases in overweight or obesity, and 2 schools also had a significant increase in the proportion of adolescents eating 5 or more serves of vegetables a day. One school, Calwell High, achieved their specific school aim of a significant reduction in depressive symptomology. The action plan for Melrose High School was to increase the number of students using active transport to and from school. Here, teachers modeled healthy behavior by choosing to walk or ride to school themselves and participate in weekend social fitness activities as well. A new food committee was established and consulted with Nutrition Australia and the canteen provider to produce a new food policy promoting healthy eating. As well as the healthier food options available, the mandate to make a profit was removed and the traffic light system was introduced. Most of these changes were made by June 2013. A vegetable garden was established in June 2012. And although the garden to plate nutrition classes were cancelled due to a lack of staff or support, a healthy recipes initiative was provided by the school canteen, 2 water stations were installed, and the school website included healthy eating tips along with a page dedicated to the ACT IYM program. Additional initiatives supported increasing the awareness of healthy foods at school. They developed a fundraising policy for school carnivals which allowed only healthy options, a fruit day that involved students handing out fruit and encouraging teachers, particularly males, to act as role models for cooking classes. Surprisingly, the student survey showed students' perception of teachers being good role models had decreased from baseline to follow-up. Actions to intervene at Melrose High predominantly involved promotion of physical exercise and the canteen improving its nutritional quality. The Student Representative Council and student body worked with Nutrition Australia to design a healthier canteen menu. A big commitment was made to improve the food and drink choices in the canteen through linking the canteen with the school community and committing to meet the National Nutrition Guidelines. By December 2013, the canteen reduced red foods available from the school canteen from 41 to 9. New menu boards were painted and erected with an ongoing commitment to source greener options. Unfortunately, fewer students purchased their morning tea and lunch from the school canteen at follow-up, which correlates with the fact that positive weight changes among these students was unseen. Actions to intervene within the physical activity spectrum included implementing and embedding cycle education and active transport into the curriculum, building a bike compound, developing facilities to support active transport, mapping safe cycle routes, and the introduction of peer ambassadors. Social marketing was used to promote the role of peer ambassadors and the development of the cycle bus routes. By mid 2013, full implementation and integration of the cycle education into the curriculum was complete for years 7 and 8. Although the peer ambassadors were established, the cycle bus routes and start walking cycling buses were not. This was largely due to the unfavorable review of safer walking routes. A bike trailer was purchased to run excursions beyond the school and to promote riding to or from school to destinations approximately 30 minutes ride from the school. A sustainability program for the resources was developed to identify maintenance issues for all the bikes. They were serviced, oiled, adjusted, and repaired as necessary as part of the outdoor education. Another initiative introduced at this time was the fitness program using a modified high-intensity interval training with the students participating in weekly fitness sessions and purchasing new software applications and equipment. Colwell High prioritised provision of healthy foods in the canteen with the collaboration from Nutrition Australia, as well as assessing the factors that impact mental well-being and how these elements could be brought together for a positive outcome. They adopted the amber-green options and the front of sales layout was made more healthful. The final initiative was to secure funding for a breakfast club for 5 days per week and providing healthy options. This was also seen as a valuable opportunity to discuss food choices, preparation of meals, and other relevant information informally with attending staff and students. Additional initiatives included beginning a healthy habits cooking class, pilot lessons for food technology with a focus on healthy food. They also sourced products from local providers for fundraising events, like using Canberra milk instead of Woolworths, as well as the introduction of the soup kitchen that provides soup and salad rolls for lunch. The principal supported the embedding of health into all areas of the curriculum. Colwell made sustainable, cost-neutral changes through working within existing systems and forming ongoing networks. Their grant money was untouched until the last 6 months of their intervention period when they used it to fund a fitness centre. In response to the successful pilot and its successful expansion, a number of It's Your Move how-to guides have been developed, and one how-to guide in particular aims to improve the school canteen's dining space, first undertaken by Colwell High. In response to IYM in partnership with the Young Men's Christian Association and the ACT Parents and Community Council, will work with 5 high schools and colleges in 2018 to transform their dining space with recycled furniture fit-out, while embedding student leadership and innovation into the process through the Entrepreneurs IYM curriculum, which is the new delivery format for IYM programs. There are many challenges faced by the healthcare practitioners in the ever-evolving sector of health promotion. Fortunately, in Australia, we have the opportunities to build capacity of the healthcare practitioners, workplaces, organisations, and infrastructure for health promotion. At the heart of health promotion is a strongly integrated primary healthcare system that is supported by government sectors, communities, and individuals. The positive effects of health promotion depends on the intersectoral collaboration and public participation. As the community is the focus of research, there should be dialogue on equitable basis between researcher and the community. This can be achieved by increasing the numbers of partnerships between public agencies and multisectorial action, between public sector and NGOs, between the health promotion and the academia, and between the public sector and the private enterprises. which welcomes the shared learning and expertise to be integrated into more open societies and governments that encourage and establish participatory public policy process will not only lead to better political development but also ensure concerns on health and quality of life as an integral part of policy direction. A health promotion officer has skills in maintaining and improving health while reducing health inequalities among population groups. They take responsibility for a range of different action areas, including planning, development, implementation, and evaluation of health promotion policies and projects, using a variety of strategies, including health education, mass media, community development and community engagement processes, advocacy and lobbying strategies, social marketing, health policy, and structural and environmental strategies. Workforce development and capacity building strategies are also important components of health promotion practice. Working in health promotion is likened to caring for people for a living. It is a highly stimulating and rewarding pursuit that works to create important processes that enable people to lead healthier lives. One may appreciate that obesity is more than a direct result of poor nutrition and inadequate physical activity. The issue is complex, and so are some of the solutions. A multi-sectorial, multi-strategy approach with a long-term view offers the best chance for successfully addressing this important population health issue. This dynamic field requires a constant desire to learn, innovate, and adapt. Health promotion brings the opportunity to use problem-solving skills, develop interpersonal skills, and collaborate with many other practitioners from a variety of different fields to fundamentally reach a better population health outcome and bridge the way to health equality. I hope you enjoyed this presentation. Thank you for listening.